Good morning, everyone. Welcome to our public hearing. My name's Yvette Cullen, and I am the Social Services Chief over Medical and Dental Benefit Coverage for Nevada Medicaid with the Nevada Health Authority. Today, we're going to be discussing the Healthy Futures 1115 Demonstration Waiver Amendment. Next screen, please. And that's our agenda for the public hearing. Just to let everyone know, we will have time at the end of this hearing for public comments or any input that people would like to bring to the hearing. In the U.S., new cancer diagnoses in women are under 50 is on the rise. This is true for Nevada, especially within the last 5 years. Even though the American Society of Reproductive Medicine and the American Society of Clinical Oncology recommend fertility preservation consultation for this population, referrals remain low due to multiple barriers. Next screen. To provide the medically necessary procedures required by Assembly Bill 428, the Nevada Health Authority plans to make an amendment to an already existing waiver known as Nevada's Whole Mouth, Whole Body Connection for Adults with Diabetes Demonstration Project. This demonstration has a 5-year approval period of July 1st, 2024 to June 30th, 2029. Nevada Health Authority is seeking approval from CMS to amend this demonstration to add Medicaid coverage for fertility preservation services by January 1st, 2027. Next screen, please. Nevada is excited to join other states such as Utah and Illinois in addressing these barriers. This was made evident during the 2025 general legislative session. Assembly Bill 428 became law and requires the Nevada Health Authority to provide Medicaid coverage for medically necessary procedures to preserve fertility for beneficiaries of reproductive age who are diagnosed with breast or ovarian cancer and receiving cancer treatment that may directly or indirectly cause infertility. This is why Nevada Health Authority is requesting to change the name of Whole Mouth, Whole Body Connection for Adults with Diabetes, Section 1115 Demonstration Project to the Healthy Futures, Section 1115 Demonstration Project. This coverage mandate also extends to other insurance policies regulated by the state of Nevada. Next screen. The goal of this amendment request is to improve access to fertility preservation services for Medicaid beneficiaries of reproductive age diagnosed with breast or ovarian cancer at risk of infertility due to cancer treatment. The proposed benefit design for fertility preservation services offered will be collection of eggs, including ovarian stimulation medications that are not otherwise covered under Nevada Medicaid state plan, and monitoring through pelvic ultrasounds and blood tests to track follicle growth. Egg retrieval through a transvaginal ultrasound guided technique to remove eggs from the follicles for freezing, and cryopreservation storage of retrieved mature eggs, which is covered as a single payment for an 8-year period. The individual remains eligible for Medicaid after the 8-year storage period. The beneficiary may request an additional storage period of the same term. The individual loses Medicaid coverage during the 8-year storage period. The stored eggs will remain in storage for the full 8 years. Who would be eligible for this benefit? Medicaid beneficiaries aged 15 years to 49 with a diagnosis of breast or ovarian cancer at risk of infertility. Investigational or experimental procedures and post-cryopreservation procedures will not be covered under this benefit. Cost sharing will not be imposed on the fertility preservation benefit, and the benefit will be available statewide and provided through the fee-for-service delivery system. Next screen, please. The projected waiver impact. For the current waiver special terms and conditions, the state must provide a data analysis identifying the specific with waiver impact of the proposed amendment on the current budget neutrality agreement. This amendment does not impact the existing budget neutrality agreement for the dental benefit for adults with diabetes. No enrollment limits will be applied to the demonstration. This demonstration is not expected to increase enrollment projections for Nevada Medicaid. The waiver will be available to Nevada Medicaid recipients based on clinically defined need rather than waiver-specific eligibility criteria. As the current demonstration for dental services for adults with diabetes ends June 30th, 2029, the projections for fertility preservation services align with the remaining demonstration years and are provided below. Actual expenditures under the demonstration will vary, with the figures below representing the amounts up to which the federal government will share in the cost. Next screen, please. Nevada Health Authority, along with an independent evaluator, will submit an evaluation designed to the Centers for Medicare and Medicaid Services using quantitative measures to test the demonstration hypothesis. The hypothesis is that the demonstration enables individuals diagnosed with breast or ovarian cancer who face infertility risk to preserve the ability to have children in the future. Final hypothesis, research questions, measures, data sources, and analytic methods will be finalized with CMS during the evaluation design process. Goal 1 is to improve access to fertility preservation services for the Medicaid beneficiaries of reproductive age diagnosed with breast or ovarian cancer at risk of infertility due to cancer treatment. Hypothesis 1, the demonstration will allow individuals diagnosed with breast or ovarian cancer at risk of infertility to preserve the ability to have children in the future. And the research questions below. Does the demonstration allow individuals diagnosed with breast or ovarian cancer to preserve their ability to have children in the future? What barriers and facilitators to demonstration participation did beneficiaries experience? And then we have the anticipated measures, data sources, and analytic approaches. Additional research questions: what barriers and facilitators impacted the state's implementation of the demonstrations? What strategies supported addressing barriers? And what barriers and facilities did providers experience in delivering fertility preservation services to the demonstration population? Again, we have anticipated measures, data sources, and analytic approaches. The following table summarizes the anticipated waiver and expenditure authorities needed for the fertility preservation benefit. This amendment request does not impact existing waiver expenditure authorities for the dental benefits for adults with diabetes. The requested authority is waiver of Section 1902A-10B of the Social Security Act, amount, duration, and scope of services and comparability. The use of authority is to enable the state to provide fertility preservation services for these beneficiaries. The expenditure authority for fertility preservation services for beneficiaries diagnosed with breast or ovarian cancer is another requested authority. And federal Medicaid map for fertility preservation service expenditures for full benefit Medicaid eligibles of reproductive age, again, who are diagnosed with breast or ovarian cancer and receiving cancer treatment that may directly or indirectly affect fertility, infertility. And I need to make this screen bigger because I cannot read it. Public notices process, April 8th. The proposed demonstration amendment was discussed at a tribal consultation meeting. Tribal consultation period began via transmission of the formal tribe consultation letter. May 1st of this year, Nevada Health Authority published notice of the public comment period for the fertility preservation demonstration amendment on our website and at the state's administrative record. Nevada Health Authority also used an electronic mailing list to notify the public of hearings and opportunity to comment on the proposed demonstration. May 1st, 2026 to June 5th of this year, Nevada Health Authority is conducting a 35-day public notice and comment process and exceeded the federally required public comment period of 35 days. May 27th, 2026, today, our first public meeting. June 3rd, 2026, we will also convene at the Medicaid Advisory Committee meeting. All materials, oh, I'm sorry, Sarah. Next screen. Next slide. All materials, including the published notice, hearing information, and draft amendment application were made available online at nevadamedicaid.nv.gov, programs, waivers, oral health demonstration waiver. The public hearing agendas, public notices, and the draft amendment application were also made available online at nevadamedicaid.nv.gov, public notices, meetings, public notices, and at Nevada Health Authority offices throughout the state. Public was invited to submit written comments by email to 1115waivers at nvha.nv.gov or by mail to 9850 R Boulevard, Suite 200, Reno, Nevada, 89521. And now I would like to open it up for any questions, comments, or feedback. Minden?
Thank you. I just wanted to let everyone know we have extended the public comment until June 19th.
Thank you, Minden. Appreciate it, Minden. Thank you so much. Are there any comments or questions, any feedback? I can't tell if there's hands up.
I don't see any hands up.
No hands up.
And there's nothing in the chat.
Okay. I guess we can put the last screen up. So anyone is always welcome to go to Nevada Medicaid Home, sign up for our newsletter. We have all of our upcoming events listed on our public notices. And if you'd like to contact us regarding this waiver or any waivers, you can reach out at 1115waivers at Nevada Health Authority, NVHA.nv.gov. And this concludes the public hearing for the Fertility Preservation 1115 amendment. Thank you so much.
Thank you.
Thank you.